It's scary to think just how fast our whole world has changed in just a blink of an eye. Just a few short weeks ago, some of us actually still felt some sense of normalcy in our daily lives. Despite the fact that we're constantly being bombarded by the coronavirus news headlines, things were just not as overwhelming as it is today. Yes, we were terrified back then, having heard about the huge spikes in new cases of COVID-19 happening in China, Italy, and other parts of the globe. But most of us still managed to go on about our daily routines. But never in a million years could any of us have anticipated the 360-degree turn of our lifestyle as a result of this outbreak. Going to work or school, dining in at our favorite restaurants, going on a date at the movie theaters or bars, staying fit at the gym, even being able to hear Mass at church, all factors contributing to our daily normal life, now ceased operations as everything came to a halt. It's important to remember that amidst the growing coronavirus pandemic, it is still within our power to minimize the spread of this deadly virus. True enough, it will get worse before it gets better, but please do not lose hope. Today we will tackle Sir John's top 10 simple tips to minimize the spread of coronavirus. But before we begin, it's equally important to be familiar with the common symptoms of the virus. Symptoms 1. Severe cough. Patients suffering from coronavirus have severe coughing issues. The severity can last for days or even weeks. Lungs grow weaker, which leads to Symptom 2. Difficulty breathing. As the virus penetrates a person with a weak immune system, the lungs' airway passages are blocked, and the simple act of inhaling and exhaling is carried with extreme difficulty. When the lungs are unable to transfer enough oxygen into the blood vessels, the body suffers oxygen deficiency. This makes the patient weaker and weaker. Symptoms 3. High fever. As we know, the body's optimal body temperature is at 37 degrees Celsius, or 98.6 degrees Fahrenheit. Due to weak muscles and less oxidation, the body goes onto a stage of high fever. The patient suffers from severely high body temperatures. Symptoms 4. Common cold and headaches. It gets even more difficult to diagnose the symptoms since it can act like the common cold. It's also quite tricky because some patients appear to get well for a short period of time, right before experiencing more complications. Then, as they seem to think that they're getting better for the second time around, the virus moves on to a much deeper stage all over again. By the time it's diagnosed, it's often far too late, and the virus may have already been passed on to others with weak immune systems. Quite depressing and frightening at the same time, isn't it? Now it's time to talk about Sir John's top 10 simple tips to stop the spread of coronavirus. Number 10. Frequent hand washing. As basic as this may sound, thorough and frequent hand washing is probably the single most effective habit to practice. According to the CDC, Center for Disease Control and Prevention, it's important to scrub all the surfaces of your hands, which most people don't do. If you work at a fast food or other essential business establishment which serves the general public, it's strictly advisable that you wash your hands every 15 minutes. Proper hand washing means scrubbing hands with soap and water for at least 20 seconds. Wash between your fingers, under your nails, top and back of hands, and use clean paper towels when turning off the faucet, as a courtesy to the next user. On top of this, you may also use an alcohol-based hand sanitizer, along with disposable gloves, which you must change as often as possible. Remember, whatever you do, please do not shake hands with others to combat the spread of the virus. Number 9. Keep your hands off your face. According to the World Health Organization, touching the mucous membranes on your face with your dirty hands allows germs that cause respiratory infections to enter your body. So whatever happens, and as hard as this may sound, you must keep your hands away from your eyes, nose, and mouth. Number 8. No sharing. No sharing hugs, no sharing kisses, and definitely no sharing food. Do not even share pens with your co-workers. It's best to carry your own pen for safety measures. Also, be extra careful and cautious of surfaces you touch in public, such as washroom doorknobs, shopping carts, elevator push buttons, countertops, and other high-touch surfaces. Number 7. Disinfect, disinfect, disinfect. Think about the things you touch multiple times a day, like your cell phone, remote controls, computer keyboard and mouse, ATM cards, refrigerator doors, cabinets, house or car keys. Think about the millions of germs lingering on them. Sanitize them well and use disinfecting wipes often to quickly clean down surfaces. Number 6. Utilize technology. Instead of in-person meetings for work or business-related matters, utilize technology such as video conferencing. There are tons of free resources available online which can help you be productive while working at home. If meetings must be held in person, they should be in open, well-ventilated spaces. Number 5. If necessary, wear face masks. When experiencing symptoms like the common cold or severe cough, make sure you wear face masks whenever you're out in public to prevent the spread of the virus. However, you must respect the urgent needs of others, especially those working in healthcare. Some people who hoarded face masks are making it unavailable for those who are at high risk. Healthcare units have reported the limited supply of face masks and other medical supplies, so please do not hoard them. Now is not the time to be selfish. If you could, donate your extra supply of face masks to people or establishments who need it most. Number 4. Self-care. Eat healthy foods, stay hydrated, and take your multivitamins to boost your immune system. Regularly take a bath, wash your clothes, change your bed linens, and go above and beyond in observing proper hygiene. Number 3. Self-isolate. You must stay at home whenever you're not feeling well. It is not worth risking the lives of others you'd be encountering at work or even your loved ones, especially children and the elderly, who are at most vulnerable. Divide your home and provide protected space for those who are sick, while assigning an individual to take care of them. Always check up on people you care about to ensure that they're all right. Number 2. Social distancing. Whenever you're out in public, make sure that you stay at least 6 feet apart from others. Avoid unnecessary travels or attending public gatherings. Since religious events, schools, music festivals, and sporting events are temporarily being suspended, it's best to stay home and follow the guidance of your health and government officials. And number 1. Act as if you already have it. We may not be able to stop the spread of the virus completely, but we should do our part to at least contain it. The scary fact remains that we may all be carriers already, yet we don't even know it. No symptoms does not always mean that we're all cleared. Remember, it may take up to 2 weeks before symptoms actually occur, and by that time, you may have already infected several friends and loved ones unintentionally. By practicing these 10 simple tips, you are doing not only yourself but your loved ones a favor. Ultimately, fighting the virus depends on you and your responsible commitment and discipline to ensure that you're taking these tips seriously. If we're able to slow the virus down, it can potentially save hundreds of thousands of lives. It's only going to work if enough of us does our part. Not doing so can mean the difference between life and death of somebody you may know. Don't forget to like, subscribe, and share this video to help you save a life today. The world is counting on you to do the right thing. If you were to take home just one lesson from watching this video, it is that your decisions determine your destinies. So make it a good one. Please keep yourself and your loved ones safe. On a lighter note, while most of the world are under a stay-at-home order, a lot of people are wondering about the top 10 fun stay-at-home activities to consider during the pandemic. Well, that's another topic we'd have to explore on another video of Sir John's Top 10.